Hey folks, it's Patriot Nurse. Thank you for joining me. Today in this video, we're going to discuss some very important points that you need to know to keep yourselves and your family safe if you have to go to the hospital. This could be for a surgery or any type of visit that you have to the hospital, but we're going to cover these important points. Let's get started. So in this video, I have several things that I want to go over with you, and they're not necessarily ranked in order of importance, but each of them is very important to understand. But before we really go into this, I want to make a mandatory prereq statement here. Everything that I am describing here is a sum total of my experience in nursing from working as a nurse and then also having family members being, unfortunately, subject to the whims of the medical industrial complex through one surgery or another, one intervention or the other. I'm going to describe things, unfortunately, in a matter-of-fact way, and I'm going to call it like I see it, a spade, and it's pretty nasty in a lot of it, but the working assumption here that we're going on is that most of the time when you don't get the care that you wish you got, most of the time it's because people are really trying their best, your nurses are trying your best, your CNAs are trying their best, the healthcare providers and techs and doctors are trying their best, but they're not capable of giving you what they really wish that they could for one reason or the other. So always default to interacting with people kindly and really in an understanding way if you can. If you put out kindness and you put out respect in your communication, most of the time you will receive that back. But there are a few cases in which you won't and you need to be prepared to deal with those. So in all cases, default towards positivity and kindness, but be prepared to deal with things if you don't get respect and kindness back. So I've got a handful of things to discuss with y'all today, and effectively there's about 9-10 things just depending on what we have, but I think you're really going to want to stay throughout the entire video because there's going to be some very valuable points here that hopefully will save you from some heartache and some frustration when you go in. The first thing that we need to own, though, is that the healthcare system has changed drastically since really the inception of the Affordable Care Act, aka Obamacare. And if you really want to know what the end result of a government program is, look at the name of that program. The results will be the polar opposite. So the Affordable Care Act, of course, has changed everything for the worse, I would submit. And there are many reasons for this, but I want to go over with you some points that are really more than just the impact of the Affordable Care Act, but are essentially the net result of a very drastic shift in demographics and an aging population, and what the impact is of the baby boomers getting older and the fact that they really didn't have enough children to replace not only themselves, but also to create caregivers for now really the generation in the United States that has lived the oldest with the most chronic diseases. So we're going to break this down. The first thing that I really want you to understand, and I'm saying this as not only a nurse, but also a master herbalist. So I do have obviously a bachelor's of science in nursing, but my master's is in herbology. So I have a very complementary viewpoint on things. And I've worked in various different skill sets, right, in my time as a nurse. And my background as a nurse is in more than just the med-surg. I have done total hip, total knee replacements med-surg, but also worked in acute psychiatric, inpatient psychiatric, labor and delivery, and also emergency and trauma, so and home health care. So there's a whole smattering of things that I've seen, and I'm bringing my experience to bear in this, and also hoping that in the comment section that my healthcare providers will comment as to whether or not they agree with this, and most of the time I think they are going to agree with this, but I'm totally willing to be proven wrong. And the first thing is you have to assume, number one, the most important thing that you really need to break down in your mind, you have to assume serial incompetence on the part of everyone that you meet. I'm going to say it again. You need to assume serial incompetence on the part of everyone that you meet. You need to assume that the hospital staff are incompetent. Now, hold judgment here on this for me, nurses, doctors, EMTs, because that doesn't mean necessarily that we treat people as if they're incompetent, but we have to assume incompetency. Not being unkind to people, but you need to assume that the person who is helping you, regardless of who they are, they may mean well, but they are either short-staffed, they were not properly trained, they don't have adequate resources, or there's some other type of interface with a technological issue that they are not capable of surmounting. You have to assume that everyone that you are engaging with is incompetent, which means then that you have to be paying attention and really doing their job for them in a way. Now, I say this as a nurse, of course, and I'm coming at this not just from my own experience and seeing the bar lowering as to assumed competency in the nursing field, but also having multiple family members have surgeries and interventions in hospitals. Even recently, I can attest that the care that they have gotten has been an inverse J curve as far as quality over the years. And a lot of it has to do with incompetency, not only of nursing staff, but also of unit clerks and really a communications breakdown. So you need to assume that they're not going to do their job as they say. You need to assume that if they say they're going to do something, you have to follow up and make sure that it's done. If they say your meds are coming at X amount of time, if it's 15 minutes after that, you're hitting that call light and asking the nurse's station where the meds are. I'm not saying like right on time, but if it's been within 10, 15 minutes and it's not there, you need to nudge a little bit and figure out where it is. And this may not make it popular, the video popular with some nurses, but I really care about patients at this point. My sister nurses will, if they have a heart and they have a heart for patient care, they're going to vouch for what I'm saying. It's true. You got to make sure, because regardless of what the situation is, people may not mean to forget about you. They may not mean to not bring you your meds. They may not mean to not do your dressing change on time, but you have to make sure that it gets done. So you have to assume either benign incompetency on the part of everyone you meet or something not forgotten. There is a sub point that I want to make on this point, and that is that there are occasionally serially malevolent people in healthcare. And I'm sorry to say it, but I've had family members that were abused by nursing staff. I had a family member who was verbally abused and also whose pain management was held back from a really nasty nurse who I could say a lot about, but the grand scheme of things, you really have to make sure that that you are following up on people. And that goes into the second point here. Do not leave your family members alone in the hospital. Do not leave them alone without an advocate. There are certain things, for instance, if someone's in recovery, that you're not going to be able to go back there with them. In certain ICUs, you may not be able to visit family except for certain windows of time. If you can stay in the hospital with your family member, you need to do it. Somebody needs to be there with them because you cannot ensure that people are being taken care of if you're the person who has been put under and you're the person who's in pain and you're the person who's had all these IV medications pumped in your system. You're not with it. So you are essentially leaving someone at the mercies of whatever incompetency or overworkedness is there. If you leave your family members there, do not leave them alone. Always have somebody with them. The third point, you have to be concise with your communication. Now, this is kind of ironic because people would say, Patriot Nurse, this video is X number of minutes long. Couldn't you have just given us the bullet points? Well, yeah, if you want the stupid Cliff Notes version, but I would have given you the expanded version of all my experience as a nurse and everything my family's had to suffer through. You must be concise with your language. What does this mean? I find this in particular to be very challenging with the baby boomers, and I'll tell you why. The baby boomers are used to, for the most part, the vast majority of their life experience was a healthcare system that actually cared about them, with doctors who actually cared about them. They were used to having a conversation with a healthcare provider, right? That is not a thing anymore. It's true. When you go in to engage with a healthcare professional, they are usually working on a 10 to 12 minute appointment cycle, which means they don't have time to listen to your entire life story. And I know that seems really harsh. If you want to communicate effectively with people, you got to have bullet points. It's got to be Cliff's Notes. You need to make a list of what you're talking about with them when you go in there. And you need to, before you know, for instance, the doctor is coming to check in on you after a surgery, or you know that your nurse is making rounds at, X number of time, find out what time shift changes and be ready to address your grievances if you have them in a respectful way at that time. But it has to be concise. We're not doing this whole sit down and I'm going to feel all of your feels and have an interchange on how it is that you're processing everything. They ain't got time for that. And they may care. That's the thing. Like, I'm a caring nurse, and the other nurses that I worked with, for the most part, not all of them, but for the most part, were caring, but they ain't got time. If your patient ratios are through the roof, they don't have time to sit and listen to all of your feels. They need to know what it is that they can action, that they can fix for you immediately. Or if they can't do it, they need to know in short order who it is that they need to contact if they can't fix it for you. So you got to know exactly what it is that you want, know the outcome that you're looking for, and be able to concisely communicate that. The next point, document everything. Everything. Now, back in the day, we used to drive this home. I actually taught for a session there. I taught nursing clinicals, and so I would teach this to my students. Like, if you didn't write it down, it didn't happen. You didn't chart it, it didn't happen. Likewise, just because somebody did something for you, or somebody told you that they were going to get you this med, or somebody told you that they were going to get you, this product for physical therapy or whatever, you make a note of that. Make a note of who told you this. And I know a lot of times people are saying, well, I'm not good with names. You've got to get good with names. I don't care. like I'm not good at such and such. If you are willing to accept your limitations, you're going to get subpar outcomes in the healthcare system. You got to fight for every inch of territory that you want to maintain in your health. Unfortunately, if you don't write it down, people are going to forget about it. They're going to forget about their promises to you, and they're not going to be able to action on what they can't remember. So you have to remind them. You have to remind them. And again, I've said this earlier in the video, but it bears keeping in mind that a lot of times that things don't go your way in getting good healthcare, it's not necessarily because of malevolence. It's because people are overworked, or they don't have the resources they need, or they're exhausted and tired. And it's human factors that are limiting things. So assume, when you're interacting with people, that it's on a kind and positive way. But you may run every now and then into some nasty people. And I'm curious as to your experiences. Leave me a comment below what your most recent run-in with the healthcare system has been. The next thing is you have to ask questions. You must ask questions. And in asking your questions, you have to, again, be concise in it. But don't assume that they're going to tell you everything you need. When they discharge you, if you're not sure of how it is that you're getting around and how it is that you're going to be able to meet your activities of daily living after having a surgery, you got to ask them, how am I going to meet this? Am I going to have home health care? Am I going to have physical therapy? Like, who is going to help me? They should be asking this for you as part of your discharge work, but more and more I've seen that people are just getting lazy and they're not doing it. The sixth one is not a popular thing, but it's a true thing. You're going to have to bribe the people that are taking care of you. And how do you say bribe? Oh, it's so unethical. It's life. It's life. So how do we bribe people? Well, your nursing staff probably is running short on caffeine and running short on calories. So a lot of times when people are in the hospital, I recommend that they take their nursing staff some type of like bagels or coffee or something like that. Is it an ideal world that we would have to bribe people to be on their best behavior? No, but it's a fact of life. And the thing is, like hospital administrators and some of these people, I'm gonna speak about them in a little bit. Hospital administrators say like, oh, we give excellent care no matter who our patients are. That's not true. That's not true. If you want good care from your family members, you got to make sure that the nursing staff knows who you are, and you have to interface with them in a positive and a constructive way, not being nasty and not being mean about it. And one of the best ways to make your introduction onto the unit is to surprise your nursing staff with whether it's coffee or bagels or whatever. And people might be really clutching and affronted by that, but it's the truth. If you want good care, then you're going to have to pay attention to the needs of your staff. Shouldn't that be compensated for, like in what I'm paying for healthcare? Nope. 7, say thank you and please. So positive communication is a cornerstone of this, a respectful communication. And it may seem like that I've set people up for believing the worst of the healthcare industry. There's a lot of good people in the healthcare industry, but they are overworked. And also the bad ones stick out too. There are some sociopathic and psychopathic nurses, doctors, and other healthcare providers, licensed healthcare providers that I have interacted with. And because of my professional constraints as a nurse, I'm not at liberty to speak about that in this format, but suffice it to say that I have witnessed some of the most atrocious things, and I took my due diligence. I did what I was supposed to do from a nursing standpoint to get them fixed, but there are some very bad people who happen to have healthcare licenses, but that doesn't mean that the good ones deserve to be treated like the bad ones. So functionally, when you interact with people, be kind, say please and say thank you. And even if you don't feel like it, if a nurse comes in and they're caring for you in the morning, they may look tired, they may look like they're exhausted, and they may not have a smile on their face. But, if you can lead positively, isn't that crazy that we're expecting the patient who is, not having the best day of their life to lead positively? If you can lead positively, or if you're the family member who's caring for them and saying, thank you for helping us today, we really appreciate your care for us. Thank you for caring for my mother. Thank you for caring for my father. Thank you for caring for... When you lead with gratitude, oftentimes you're going to receive that. When you're leading with positive vibes, you get mirrored that in many cases, if not most. But be on the lookout if you don't. If you are consistently, like after 2 or 3 times, leading with positivity, not complaints, but leading with positivity, and you're getting negative back, you might need to consider whether or not you request a change in your care provider, which you do have the authority to do. It is your complete purview as a patient receiving care in the United States. If you are not happy with the care that you are getting in whatever capacity in the hospital, and you do not, you feel like you are not being treated appropriately by any member of staff, you have the ability to request different staff, and this is where you get patient advocates involved, and you can also request the bioethics panel of the hospital to show up. I know that might seem kind of crazy. A lot of the nurses and healthcare providers are not familiar with this, but if you request either a consult with the bioethics committee, or you have, in general, any type of ethics complaint, they tend to get on that pretty quick. So you have the ability to be cared for. You have the ability to change your care out. You have the ability to request that the big guns get involved. And speaking of big guns, let's talk about hospital administrators. That's number 8. Hospital administrators are some of my least favorite people on the face of the planet. The majority of them that I've met. Okay, we had to cut there. Something funny just happened. I was actually speaking about hospital administrators, and I got bit, like really, really bad, by a biting ant, and that did not feel good. So I was about to say that hospital administrators are sociopaths and blood-sucking, psychos, and then I got bit. So hospital administrators, in many cases, are pretty nasty people, and that's just the bottom line. I have interacted with several of them, and I find them to be lacking in empathy overall, and they tend to put dollar amounts on people's lives, and it's a really kind of sick and twisted way of viewing things, but it is what they do in order to keep the hospitals in the black. And a lot of the hospital administrators, when you consider, what they do and how they make a lot of money. They can make, in many cases, more money than physicians working on staff there. And they do it by cutting corners and by ensuring that people are numbers. And there is obviously an economic equation to healthcare, but in my experience, you gotta really understand who you're dealing with. And hospital administrators are paid to give you, to charge you more and give you less. And any type of system that you're going into, it pays to know who the hospital administrator is, and it pays to know what their overall philosophy is. So, for instance, if you're looking at having a surgery and you're looking at having it at Hospital A and Hospital B, and Hospital A has an administrative staff that, are quality people versus Hospital B that are a bunch of psychopaths, and you can make your decision accordingly. 9, have a living will and a durable power of attorney. Have advanced healthcare directives on board going into the hospital. So unfortunately, this is becoming more and more of an issue, but if you are looking at surgery that may potentially be life-threatening, then you're going to want to have an attorney look over these documents for you and not just make this kind of a last-minute sort of thing. If you are, for instance, looking at having a surgery that is more interventive, it would be in your best interest to consult legal counsel in your area to determine what advanced directives need to be there as far as like life support, et cetera, interventions you do or do not want. Do you want to be resuscitated? Do you want to have them like crack your ribs open to pump on your chest? Should your heart stop? There are things to consider. And so speaking to an attorney about that, to get that documentation ahead of time, you want that. You don't want to be making those decisions last minute. And number 10 is one of the more practical things, but it's an important thing to consider. And that's pack comfy clothes and comfort items. So comfy clothes and comfort items are things that really help you convalesce better if you're going to be in the hospital for an extended amount of time. And that includes like your pajamas, some type of like comfortable shoes or slippers that are non-slip, by the way. They need to have grips on them so that way you can ambulate safely, like walk around safely. But also simple things like having an essential oil diffuser in your room. And some hospitals are kind of picky about these things. They either won't permit you or whatever to have them. But anything that you could do to make that room more homey for you and to take away the hospital smell, because hospital smells are just rank. And I can tell you after, doing my nursing servitude, aka clinicals, having to bring in breakfast to rooms that smelled like urine and feces and blood, and having to do all that for an extended period of time as a nurse, the smell, like you get used to it. But I can tell you, as a matter of fact, when a patient has made a room more comfy and more homey, and when it smells better, you're more likely to go in there. And that's the bottom line, that it is less of a mental wear for a person to go in there when they're not having to smell constantly blood and urine and feces mixed together with the nasty smell from the hospital cafeteria food. Like when you actually go in there and it's a comfy place to be, you're more likely to engage better with the patient because everybody's really at their best. And it's a psychological benefit when you think about it. So whatever psychological benefit that you can take in order to boost your overall feeling of well-being in the hospital, take it. So friends, I hope this video was helpful for you. It's a little bit it's a little bit of a sobering topic when you think about just how far things have come and how much our healthcare system has degraded over the years. But my hope is that what you've learned in this video will help you be able to have a more positive experience, and that you'll be able to be a blessing to your family members and friends who are going into the hospital. If you have a family member or friend who this would benefit, please share this video with them. That way they can be more empowered when they go to receive the care that hopefully they need and are going to get a good experience from. Part of shielding yourself from this reality of going into a hospital of a system that in the United States is just decaying and is in an inverse J curve as far as quality, you want to self-select out of this as much as possible. And really, part of your ability to avoid this unnecessary level of strain is not needing their services in the first place. So part of what I've offered here on my YouTube channel, but also in my online training and in-person classes, is I try and equip people to care for their family members' needs at home. And not only that, if you are more informed going into caring for someone in the hospital, or for instance, they're coming back home and convalescing and you're the care provider or you're the support person, if you have this type of education on board, you're going to be in a far better position to be not only the advocate for that patient, for your family member, but also you're in many cases going to catch things that are not right before even healthcare personnel will, because you know that person, you know they're normal. And if you're equipped with just a little bit of education and some practical skill sets, which I teach in my skill sets and courses online, if you're equipped with that, you're going to be able to have a much better chance of having an uncomplicated recovery and also just better question asking in general. Knowledge is power, and being able to educate yourself and have options, that's going to situate you for success regardless of what's coming down the pike towards us. So if you're interested in training with me online, I've got a couple of courses, the Foundations of Medical Prep and also the Herbal Preparedness course that I offer. Both of these are great ways to educate yourself. The 4-hour course is a great way to dip your toe in. The Herbal course is a fantastic way to really increase your capability and your knowledge base to care for your family's medical needs at home, such way you don't have to go into the medical system unnecessarily. So I also teach in-person classes, and I have a course offering coming up in Knoxville, Tennessee later this year. I have 4 days worth of course or the whole 7 days worth of coursework. So you can check that out, the website, thepatriotnurse.com. We have Medical Prep 101, 201, Nutrition, Herbs, and Old School Disease. And then we also have the Herbal Theory and Prep class with me. And it's a wonderful opportunity to train and also be amongst like-minded people. The networking in my classes is second to none. I'll hold by that one all day long. Friends, I hope the video was helpful for y'all. I hope you have a very, very blessed weekend. Share this video with one person that you know needs it. For now, it's Patriot Nurse signing off, and I'll see y'all later. Bye.